Hi, I'm Suzanne, and this is Sandy, our standardized patient, and we're going to go through the NIH stroke scale step by step. The first section of the stroke scale is level of consciousness, and we're going to combine 1A, which is level of consciousness, 1B, level of consciousness questions, and 1C, level of consciousness commands. So first, we're going to demonstrate what 0 looks like for all three of those. So when I walk into the room and I introduce myself, I'm Suzanne Wheeler, I'll be your nurse today. How are you feeling?
Hi, good.
You can see that Sandy is alert, awake, cooperative, and responsive. So she scores a 0 for the first part of level of consciousness 1A. For the level of consciousness questions, which is 1B, I'm going to ask her just a couple questions and score her accordingly. We're going to first do for a score of 0. Just going to ask you a couple questions.
Okay.
Can you tell me the month?
May.
And can you tell me how old you are?
67.
Thank you. Now I'm going to have you follow a couple commands.
Okay.
And first I'm going to have you squeeze my hands. Thank you. And can you open and close your eyes? Thank you. Now we're going to score level of consciousness. And for 1A, she was alert and keenly cooperative, so that's a 0. She answered both questions about the month and her age correctly, that's also a 0. And she followed the commands, squeezing my hands and opening and closing her eyes correctly, which is also 0. So for all three of those, she gets a 0 for level of consciousness. Now, if you walk into the room and already establish that the patient's alert, oriented, cooperative, you can go ahead and give her that 0 right away. But if you walk in the room and the patient's not alert, so let's say, Sandy, let's demonstrate for them a patient that's arousable only with some minor stimulation. My name is Suzanne. I'll be your nurse today. Thank you. So that demonstrates a level 1 for level of consciousness. So she responded to stimulation. We could go further to ask her the other questions to find out how she does on the other pieces for a 2. So for the level of consciousness questions, I'm going to ask her the same questions, but for a score of 2 on 1B, she will only answer one of those correctly. Sandy, it's me again. Can you tell me the month?
December.
How old are you?
67.
Thank you. So you can see she got one of those correctly, so we'll give her a 1 for that, for 1B, level of consciousness questions. Now, for a 1 for the level of consciousness commands, we're going to have her do the same things, and we'll get a 1 if she performs one of those correctly. Now, if the patient has hemiparesis or paralysis on one of her extremities, then we will score the other extremity that she does not have paralysis in. Okay? Sandy, can you do a couple things for me?
Mm-hmm.
Can you squeeze my hands? Thank you. Can you open and then close your eyes for me? Thank you. So we're going to score that again as a 1 because she has new weakness on the left side. She was not able to grip my hand on the left side. Now, as I said before, if you have a patient that already has paralysis, then we would not assess that side that had the paralysis before they came in, from a previous occurrence, but we could still assess it from the other side if she could follow the command. Now for level of consciousness 1A, a patient that scores a 3, that patient would be unresponsive, in a coma, or would only respond to noxious stimuli with reflexive type movement or posturing. So in this situation, first you always want to start off gently with touch and sound. Sandy, can you hear me? It's okay. Everything's okay. I'm your nurse. You're in the hospital. Just want to know if you hear me. Can you open your eyes? Can you move anything? Okay, now would be the time I want to use a little bit more touch, tactile stimulation, to see if she can respond. I might check capillary refill as kind of a irritating. And very last resort would be noxious stimuli like a sternal rub. And now when you do a sternal rub, a response might be that the patient has posturing, or they may withdraw from the noxious stimuli, and that would be a 3. So all of those would be a 3 for 1A. Thank you, Sandy. Now for the level of consciousness questions, for a 2, which is the highest score that you can get from those, is I'm going to ask her the same questions and we'll see how she responds for the 2. Sandy, can you tell me what the month is? Can you tell me your age? Okay, thank you. Okay, so in this situation, she really was not able to answer either question. If she answered both questions incorrectly, that would also be a 2. So if the patient is unable to answer, is in a coma, is stuporous, or answers both incorrectly, then those are all 2s for 1B. That's an example of that. The important part of this is we don't want to give the patient cues or encouragement. We want their first initial response on this particular question. Now for 1C, the final part of our level of consciousness commands is we're going to also look for a 2 in this, which means performs neither task correctly. So this is the one where I'm going to ask her to squeeze my hands, open and close her eyes, and she's not going to be able to perform either correctly. Okay, Sandy? You squeeze my hands. Can you open your eyes and then close them for me? Open your eyes and then close them. Okay. Thank you. So that would be a 2. So the first time trying to elicit these commands, I was not able to get a response from Sandy. So in this particular section, I can use an example. I can demonstrate to her opening and closing her eyes or squeezing my hands. So in this one, we can encourage the patient, in other words, and demonstrate. Sandy, can you open and close your eyes like this? Can you close your eyes and then open them? Close your eyes. Okay. Can you squeeze my hands? Squeeze. Squeeze me like this. Give me a good squeeze. Squeeze my hands. Thank you. So in this situation, we would still give her a 2. Even with demonstration and encouragement and what they call pantomime, she was not able to follow either of those commands. So for level of consciousness, that would also be a 2. Now, if the patient is unable to respond at all, would also be a 2. Okay? So that's the section on level of consciousness.